Welcome to Concept in Medicine. In today's tutorial, we are going to be looking at epidural hematoma versus subdural hematoma. But before we begin, let's look at the question that I gave in the previous tutorial. And the question is, why is it not advisable to vigorously suction the back of the throat during resuscitation? The reason is that vigorously suctioning the back of the throat will irritate the vagal nerve which runs at the back of the throat, causing vagal stimulation, which then activates the parasympathetic system, decreasing the heart rate, which may lead to severe bradycardia, which may be lethal. That explains why it is not advisable to vigorously suction the back of the throat during neonatal resuscitation. Congratulations to all of you who had it right. Okay, let's move on by looking at today's topic. So we'll start by comparing the epidural hematoma and the subdural hematoma. So we'll start with the first one, that is the incidence, how common it is. If we take the epidural hematoma, it is not so common, it's less common than the subdural. So for the subdural, we'll say that it is more common. The next one is the etiology. How does it come about? You should know that for epidural hematoma, it occurs in young people following a strike on the head, which may be during sports or a road traffic accident. Then the question is, how young are these patients supposed to be? Usually, age of 20 to 30 years is more prevalent, meaning you have epidural hematoma occurring in young adults of age 20 to 30 years. And the question is, why? Why? Because during that age, the calvarium, that is what we call the cranial vault, is not densely attached to the dura mater. So that exposes the middle meningeal artery that passes through that zone and exposes it to injury following a hit on the head. For subdural hematoma, they occur in adults and also elderly alcoholics following a fall. Reason is that for elderly alcoholics, their brain may have undergone atrophy, leaving the subdural space widely open, exposing the bridging veins that traverse the subdural space. So you have the subdural hematoma occurring in adults and elderly alcoholics following a fall. The next criteria is, where does the bleeding come from? When we take the epidural hematoma, the bleeding is due to an injury to the medial meningeal artery. And the medial meningeal artery, you should remember that is a branch of the maxillary artery. And the maxillary artery is also a branch of the external carotid artery. So, with that, we can say for epidural hematoma, the source of bleeding is almost always arterial. The question is, where does the bleeding accumulate to form the hematoma? You should know that this bleeding is going to collect in the space between the dura mater and the calvarium, and the calvarium is also known as the cranial vault. What of the subdural hematoma? For the subdural hematoma, the bleeding results from a tear of the subdural cortical bridging veins. It's coming from the subdural cortical bridging veins. When there's an injury to the subdural cortical bridging veins, then the bleeding accumulates in the space between the dura mater and the arachnoid mater, which are layers of the brain. And because of that, we can see that the bleeding source is almost usually venous. All right, let's move ahead and talk about the next criteria of distinction. With the next is, when you look at epidural hematoma, clinically, it is characterized by a lucid interval following an interim of loss of consciousness. And the question is, what is a lucid interval? So you should know that the lucid interval is a time range from the period the patient regained the consciousness to losing the consciousness. So with lucid interval, it will follow the patient losing the consciousness transiently. So the lucid interval here is what we are describing by full recovery of normal consciousness or near normal consciousness, and then becomes unconscious again. That is what we call the lucid interval. To be able to easily remember the lucid interval, we can simply say that lucid interval is synonymous to talk and die. Talks meaning that he or she has regained the near normal or normal consciousness. Dies means he or she has lost the consciousness again. So that is what we call lucid interval. What of subdural hematoma? For the subdural hematoma, the patient gradually loses the consciousness. The patient gradually loses the consciousness due to increasing mass effect. Why are we saying that? Because the bleeding is from the vein, and bleeding from the vein is slow, so it takes time to build up. And as it builds up, the hematoma increases in size and then compresses on the brain matter. And that would cause the patient to lose consciousness. For subdural hematoma, classically, they don't present with lucid interval. But in severe cases, yes, there could be lucid interval. But when we are talking about lucid interval, classically, it is associated with epidural hematoma. Let's look at the next criteria for distinction. The next one is when you are talking about the CT scan finding, and the CT scan is going to be a non-contrast CT scan. What are you going to see on a non-contrast CT scan? For the epidural hematoma, you will see on a non-contrast CT scan a lemon shape or lentiform or biconvex shaped or lens shaped lesion, and these lesions do not cross the suture lines. They are limited. They do not cross the suture line. They are limited by the dura mater and the cavarium. Hence, they do not cross the suture lines. What of subdural hematoma? With the subdural hematoma, on a non-contrast CT scan, you will find a banana shape or a concave shape or a crescent shaped or a half moon shaped lesions. And for these lesions, they cross the suture lines. They usually cross the suture lines. That is for subdural hematoma. Then finally, with the treatment, when you take the epidural hematoma has two modalities of treatment. That is the surgical treatment and the conservative treatment. But the surgical treatment is going to be applied most due to the impact of the epidural hematoma. With the surgical treatment, what is done? It means with the surgical treatment, you are going to have an expedient evacuation via craniotomy. And when is it indicated? When is it indicated? It is indicated when there is a symptomatic large epidural hematoma with Glasgow Coma Scale less than or equal to 8/15. If the patient has a large symptomatic epidural hematoma and the GCS is less than or equal to 8/15, then surgical treatment is indicated, where expedient evacuation via craniotomy will be done. When is surgical treatment not indicated? That is the conservative treatment. For the conservative treatment, use it for small asymptomatic epidural hematomas with a Glasgow Coma Scale greater than 8/15. Let's move ahead and talk about the subdural hematoma. For the subdural hematoma, with the treatment, same, there are two treatment modalities. We can talk about the surgical treatment and the conservative. With the surgical treatment, it is going to be by drainage via bare holes. That is bare hole craniotomy. They are going to drain the mass by bare hole craniotomy. So simply drainage via bare holes. And when is the surgical treatment indicated? It is indicated when you have a symptomatic large subdural hematoma greater than or equal to 10 millimeters in size, or you have symptomatic subdural hematoma causing a midline shift greater than or equal to 5 millimeters. Then it is indicated for surgery, where you have drainage by bare hole craniotomy. Then when don't we do the surgery? When is surgery not indicated? That is the conservative treatment. For the conservative treatment, we are talking about it being indicated for patients with asymptomatic small subdural hematomas. That is how to differentiate between epidural hematomas and subdural hematomas. And again, to add to that, when you take the subdural hematomas, clinically, they can come in three forms. That is acute subdural hematoma, the subacute subdural hematoma, and the chronic subdural hematoma. The difference here is that for the acute, it occurs abruptly, and it comes with focal neurological deficit and loss of consciousness. That is altered mental state. When you take the chronic, these things happen gradually. It has a gradual onset. And if you take the subdural, it could be described as an acute or chronic, meaning it will have both chronic and acute features. The last thing I want us to look at is how to simply and easily remember the difference between the epidural hematomas and the subdural hematomas using the non-contrast CT scan finding. So we said that if you have a banana shape, then you are thinking of what? Subdural hematoma. And if you have a lemon-shaped lesion, you are thinking of epidural hematoma. Then how do we remember this? If you want to remember, if you take the subdural, sub has a B, and that B connotes to banana. So that is banana-shaped lesions. If you are banana, it means you are half moon, you are concave, or you are crescent-shaped lesion, and that will go for subdural. So if you have sub B for banana, simply sub B in the sub for banana shaped lesions, and that will go for subdural. What of the epidural? Epidural, we say when there's a lemon shape. The lemon shape is also the same as a biconvex shaped lesion. Then in that case, if you are saying convex, if something is convex, take this as convex. And if you look at the top, it resembles a mountain. And if you are standing on top of a mountain, we say you are on top of a mountain. And when we say on top, it refers to epi. So anytime you hear epi, it means on top of a mountain. And the mountain is describing a convex shaped lesion. If you see epidural, it means what? It is convex, because convex is synonymous to mountain. And if you are saying epi, it means you are on top of a mountain. So remember that epidural goes for what? Convex shaped, and that will connote to the lemon shaped. I believe we've learned something new today. But before we end the lesson, I have a question for you. And the question is, which structure is responsible for the production of cerebrospinal fluid? Kindly make sure to subscribe to my channel, like, share, and also comment the next concept you would like to see in my next tutorial session. My name is Dr. Del, and once again, this is Concept in Medicine. Bye-bye.